you have a look of my slides? I'm sharing a slide on neurolocomotor. Okay. So in some material, you can be able to appreciate that some books call it the nervous system or simply the neurolocomotor because it's the system that control all other parts of the body. And if you have done anatomy part of it, which I hope you have done, we'll only be placing a little bit of physiology because that's where a lot of complexity comes in. But as I promise, I'll keep it short and a little bit also briefer. So the nervous system composed of the brain and the spinal cord, and we call that one the central nervous system because it's centrally located. And anything else outside it, we call it the peripheral nervous system. And the peripheral nervous system consists of all the cranial nerves, which are 31 pairs, and they exit at different part of the body, starting from the highest point possible into the lowest point possible along the spinal cord. This is still a subdivision part of it that we have the central and the peripheral nervous system, and the central is made up of the spinal cord and the brain. The brain is made up of several parts, as we'll see later, but the spinal cord is generally divided into the inner section called the gray matter, which appear grossly a little bit grayer, and the paler section, which you call it the white matter in the outer section. And the peripheral nervous system is made up of the 12 cranial nerves plus the 31 pairs of spinal nerves. So the 31 pairs include the 8 pairs of cervical, 12 pairs of thoracic, 5 pairs of lumbar, 5 pairs of sacral, and a pair of coccygeal nerve, which is simply a fusion of several nerves into one. And they all exit at the level of the equivalent vertebrae. For example, the C1 or the cervical number 1 exit at the level of the first cervical vertebra. And for example, the T1, where exit between the C8 and the T1, that is where the T1 exit this vertebral column. So the cerebral cortex or the part of the brain include the following globes. We later see their functions. We have the frontal, temporal, parietal corresponding bones of the skull. Remember, your fetal part of the skulls before the fusion happens, where we have a very clear landmark of the bones of the skull. So, and we also have the part of the brain called the brainstem. The cranial nerves are simply the nerves that exit from the brain, and they are not part of the cranial nerves, and they include the 12 of them. We've been talking a lot about them. We have the olfactory that is involved in the sensation of smell. Optic nerve is concerned with the vision. The oculomotor involved with the motion or the movement of the muscles of the eye. We equally have the trochlea that serve the same purpose, and the trigeminal nerve, meaning there are 3 branches, which supply most part of the face for sensation. You have the abducens, which is a motor function of the eye, control the eye movement. It moves the eye towards the medial location. We call that one the abduction. We have the facial nerve, which is both a sensory and the facial. We have the vestibular, which is involved in hearing and balance, sometimes called the vestibular cochlea. And then we have the glossopharyngeal, which supply most part, either motor and visceral, for the muscles of the throat that is involved in swallowing, involved in the production of voice. And then we have the vagus nerve that we did talk about yesterday when we talk about the GIT, that it supply the rest of the internal organs. And then you have the accessory muscles that exit the brain at the highest level, almost above the C1. And that one is involved in the movement of the muscles of the neck or the throat. And the last one is what we call the hypoglossals, and it's from the word hypo, just below the tongue. It's involved in the movement of the tongue. Those are the 12 cranial nerves. So we have some that are purely sensory, some are purely motor, and some are mixed, having 2 aspects. So the nervous system, we can also subdivide it in terms of the functionality, whether it plays a role in sensing information, and call that one the sensory, and another name is afferent. And once the information or the impulse has been sent into either the spinal cord or the brain, it has to be interpreted. And the interpretation is done by part of the neurons, we call it the integration part. And lastly, after interpretation, so the output has to be released and in form of a motor. We call those one a motor affected in, like, for example, a muscle contraction. Your ability to move your hands right now is an example of a motor activity. As I talk right now, that's a motor activity, and several muscles are coordinated together at level. For example, your parotid gland is connected to several nerves and any other gland in the body. You remember yesterday we talked about parasympathetic and sympathetic, and one could cause the secretion, other one could be inhibit the secretion. That's an example of a motor activity. And diagrammatically, this is as by the deep green color, and whitish part represent the peripheral or nervous system, where we have the receptors and the effector. Integration happen at the level of the spinal cord and the brain. So that's still another diagram in a more illustrative way. Illustrate, we have a stimulus here, like for example, in form of a pain. The sensory will be sent into the spinal cord and interpretation will happen. And if the stimulus is nauseous, like a pricking needle or a band, you'll be able to withdraw your hand, and you call that one a spinal reflex. Still, description of it that we have the somatic and the visceral. The sensories for that are available in your skin, those are for temperature. We are for pain, vibration, and sensation. We call the proprioception. Or they could be internal and call that one the visceral. So it means it lies within your internal organs. They're able to sense temperature, and they're able still to sense a sensation of stretch. And in terms of pain modality, they're not so good at that because of the distribution of receptors. We can also classify it into either somatic or autonomic. So somatic means they are connected into the skeletal muscles, and usually call that one the voluntary. Autonomic, we also call it involuntary, and they supply all the smooth muscles. Remember, I say anything circular in the body is made up of smooth muscles, and we don't have a conscious control of it. And also including part of your heart, the cardiac muscles, as we see later. And I say skeletal muscle is both voluntary and involuntary. We can distinguish between the somatic and the autonomic nervous system, that the neurons in the somatic is made up of one muscles, and the autonomic is made up of two muscles or two branches, as you see in the next slide. Diagrammatically, we can still put it in a diagram form, that we have the central nervous system here, we have the peripheral, and the peripheral is made up of both somatic and autonomic. Autonomic is with muscles, or it could be an adipose tissue, for example, the fat cells. Still also just another diagram illustrating on the same, that we have the central nervous system here, which is could be somatic or autonomic, and we have a diagram illustrating all of them. So we have the specific receptors that enable the autonomic nervous system or the somatic nervous system to take an effect. So they have very specific receptors, and you have neurotransmitters within them. I think the biochemistry class did a justice to you in taking you through all types of neurotransmitters. And for example, some of the receptors, including the muscarinic receptors, and these are the receptors for acetylcholine, and it includes both nicotine and muscarinic. And we can block the receptors using some drugs. For example, atropine is able to block the effect of acetylcholine, and a drug called curare can be able to block the effect of nicotine. And later in pharmacology, you realize the utilization of what you call an agonist and antagonist. An agonist is something that stimulates a receptor. Antagonist is something that blocks the receptors. So the divisions of the autonomic nervous system, we can classify it based on the origin, the length of the pre and post neurons. So these are the neurons that supply the effector organ, and the positions of the ganglia, or simply the neurotransmitter that is involved. So we can start the first one by looking it in terms of the area of origin. So this is a spinal cord starting all the way, this is the brain, T1, all the way to S4. And anything that originate will start from the sympathetic nervous system. Anything that originate from T1 all the way to L2, we call that one the sympathetic nervous system. And above T1, we have the cranial nerves. All the cranial nerves are parasympathetic. And if you move down all the way from S3 to S4, that one still become parasympathetic. So from this description, we can say the thoracolumbar, anything that starts from the thorax to the lumbar, we call it sympathetic branch. And anything that starts from the craniosacral, so from the word cranium, meaning it involves the cranial nerves, and the sacral plexus, that is S2 to S4, are parasympathetic. That was one classification based on the location. So we can also do a comparison based on the action that what does it does. So we can summarize all of it that the parasympathetic nervous system is involved in resting and digestion, and that one is more pronounced in the GIT. And the sympathetic nervous system is involved in fight or flight. So anything that makes your body to be ready to fight or run away is the function of the sympathetic nervous system, and anything that makes you calm and digest, that is the parasympathetic division. That is another modality of classification. But here's the special cases where both of them work together in the same effector organ. An example would be during sexual intercourse. But for you to have an erection, you need the parasympathetic to ensure we have the relaxation of the blood vessels and ensure we have the filling of the blood into the corpora of the penis to, and that one makes it rigid, and that's how an erections come in. But for the process of ejaculation requires an action of contraction of the some muscles, and that is an action of the sympathetic branch. Eye movement, for example, you are running away because you've been scared and your eyes need to be dilated. That's a function of the sympathetic. And sometimes when you just relax, like right now, your pupil is a little bit constricted, and that is the effect of the parasympathetic. Urination, for example, is the same with defecation. So we need parasympathetic for you to urinate, and the sympathetic will cancel that one effect, as we learned yesterday and while we were doing the urinary system. So that is another modality based on the function or on what it does. We move ahead and see some other also aspects of the cells that are within the nervous system. And we did talk about the sensory cells, we did talk about the motor cells, and in between, we have an association called the interneurons. So these are other cells that plays a very specific. So the cells in the nervous system are either neurons or neuroglia. So these are other cells that perform any other function. So the neuroglia, we have the one that located within the central nervous system. One is the Schwann cells that covers the neurons within the central nervous, the peripheral nervous system. A process, we call it myelination, to ensure that the conduction of an impulse is open nervous system. Another cell called oligodendrocyte does the same work. You have the astrocytes that maintain the blood-brain barrier, and we have the immune cells of the nervous system. We call them the microglia. Also, we have some cells called the ependymal cells that secretes the CSF, as we see later. And at the periphery, we have the satellite cells that almost does the same functions as astrocytes in the peripheral nervous system. So those are the neuroglia, or the cells of the nervous system. So brain metabolism, we did talk about the cardiac function, and the cardiac function, we did talk about the cardiac output. And the cardiac output is what percent of blood is being sent to each and every part of the brain. While we were talking about the renal, so we say that the kidney receive about 25% of the blood, and we say the purpose of that one is to ensure that the blood is filtered or to enhance the GFR function. The brain requires about 15%, and the supply is constant. Each and every time you see it, you sleep, the supply is constant at a very specific rate. So that 15% is maintained throughout, because each and every time you have a reduction in the blood supply to the brain for even like 5 seconds, immediately unconsciousness will set in, because the brain is so much selfish that it will try to reduce the blood supply to the brain for even like 5 seconds. So that one can be demonstrated well when someone faint. Maybe you went into a ward for the first time and you felt scared, or someone frightened you, or someone knocked you, and you become unconscious immediately. Usually the first thing that happens is someone falls down, because the blood supply to the other part of the body, mostly skeletal muscles, is cancelled out, and it will be reserved for the brain, and that is a protective mechanism that depict the selfishness of the brain, that it sacrifices other organs for it to maintain the blood supply. It's a protective because otherwise, without supply to your brain, of course, you will die and other organs will be useless. So the regulation I said is a constant, and usually it's a rate of about 50 to 150 millimeter of mercury, and that rate is kept constant. It doesn't go high and it doesn't go low because of what you call auto-regulation. Okay, let's talk about what exists just outside the brain. We know we have the CSF, and the CSF is secreted by the coronary plexus, which are usually located on the top of the lateral ventricles and also the fourth ventricles. And the function is to, the brain and the spinal cord actually floats in it, and it creates what you call the buoyancy. And that one brings an aspect of protection, that such that when you get a concussion, so your brain is suspended in a fluid and the impact will not be transmitted into the matter of the brain. It also has a function of clearing the waste and prevent ischemia. Normal pressure is about usually 100 millimeters of mercury, and it can be measured while doing a procedure called lumbar puncture. So this is a diagram just illustrating that we have a coronary plexus, and the mechanism of secretion is through the secretion of sodium, and chloride will follow it later, and water will follow also instantly. So the secretion, we said, happen within the ventricles, what you call the coronary plexus, and later it will be reabsorbed. In case we have a blockage, we'll end up with what you call the hydrocephalus, when the channels that drains it become blocked. Still a diagram illustrating that we have the two lateral ventricles here, and we have the third ventricles. In between them, we have the fourth ventricles, and we have all those, the Sylvian aqueduct connecting the fourth and the third ventricles. In terms of chemistry composition, how does the CSF look like? It will be best if you observe the procedure, but usually a very clear fluid that has a slightly higher density than water. And some parameters, for example, we use mostly protein and glucose. So the glucose is lower than blood, protein is equally lower than blood. And in case we have an abnormality, for example, we have a condition like meningitis, which is simply the inflammation of the meninges. So the bacteria tend to consume a lot of glucose, and the glucose will go down. The color will change from clear and become a little bit turbid, and the blood might leak into it. Usually, it doesn't have any blood within it. Between blood and the brain, we have some tight cells, and you call that one the blood-brain barrier. And the barrier has some function to ensure that the component which are toxic in blood doesn't go all the way into brain, and because the brain is very sensitive. And in a situation we have a condition like meningitis, that is the inflammation of the meninges, the integrity of the blood-brain barrier will be impaired, and some blood can go into the brain, and usually the pressure, what you call the intracranial pressure, can increase, and all the symptoms out of meningitis can be attributed to other noxious substances entering the brain region. So that is still, and the function that plays that role, we say that the astrocytes are the cells that ensure that we have very tight junction and maintain that one. In some region in the brain, we don't have the blood-brain barrier. And for example, the vomiting center, where once, for example, you have higher levels of circulating cytokines, it able to make you nauseated, and that one function to create a sensory or the receptors for testing the nauseous substances in blood. And that will bring a problem. For example, most of the drugs are unable to cross it. And when we have an infection in the brain like meningitis, most of the drugs are unable to get into the brain because of that tightness. And some mechanisms have to be employed to ensure we deliver a good quantity of drug. For example, a drug like ceftriaxone, usually for treatment of other infection, a dose of 1 gram is given, and that one is enough to take for 12 hours. But when you have meningitis, the dose has to be double, of around 2 grams per 12 hours, to ensure we have a sufficient concentration in the brain. And that is because of the effect of the blood-brain barrier. So it have positive effect, but in case of an infection where we want to treat something in the brain, it becomes a little bit of a problem. Let's talk about the specific part of the brain. We have been talking about the outer sides of the brain, and I said we have these lobes. We have the parietal, temporal, occipital, and the frontal lobe. Each one of them has a specific functions. So the parietal is majorly for sensory, and the temporal lobe is involved. It has the primary auditory center. This is where the receptors from the vestibular cochlea end up in. You have the occipital region, which is involved in the coordination and eye movement. So the optic nerve end in the occipital lobe. And then we have the frontal lobe, which is the primary sense motor region. It's also involved in what you call the executive function, your ability to have to reason out abstractly, planning into the future. That is a function of the frontal lobe. So see a diagram illustrating here. We have the central sulcus here that divide between the anterior part and the posterior part. And this is where we have the frontal lobe, we have the parietal ear, the temporal is here, and just slightly at the extreme posterior side, we have the occipital lobe. We have the language areas, which are the two. We have the Wernicke's areas and the Broca's areas. They have been named so because of the individual who did the initial dissections and identify that one. So they were initially identified individuals who have impairment in that region. For example, the first case is someone who had a tumor in the Broca area, and that person is unable to talk coherent word, and the guy called Broca named it after himself. And for individuals who are left-handed, so it's usually available in the other side, because if you are left-handed, it means the part that regulate your left hand, your right hand is on the left side of the brain. And in a normal population, for example, in your class right now, maybe just a 4% or 5% of the individual are left-handed, so the rest are right-handed. And if you're right-handed, it means the dominant area is the left part. So for that reason, the speech area in 95% of the norm of the population is available in the left region. The motor areas, I said initially, are mostly the frontal part of the cortex, and we have the primary area, and then the premotor area, and the supplementary area. This is where an idea to make any movement is usually originates, because before you move a hand, you think about it, and the process of thinking, so there's a communication between your frontal part of the brain and the motor region to ensure a signal is sent into the muscles that control your hand, and that's how you able to move your hand. Or before you say a word, you think about it, you contextualize it, and then you say it. And actually the pronunciation of the word involves the movement of the vocal cord, and that information reach there via the glossopharyngeal nerve, with the help also a little bit of the vagus nerve. It talks about lateralizations here. So it simply means, one part, we have the two brain hemisphere. One part, we usually call it the dominant part. And the left part tend to be involved in activities such as writing, mathematical thinking, language. But the non-dominant part, which is usually tend to be the right hand in most individual, is involved in other activities such as music listening, the verbal visualization, but a very important, what you call the spatial relation, your ability to navigate. You can close your eyes and create a map of a very specific region. That is what you call the spatial relation, or the spatial memory. Still a diagram here just illustrating the more part of the brain that is more of anatomy. Let's look at the brain stem. So the brain stem is made up of this part. We have the medulla, pons, and the midbrain. And the midbrain is made up of these two regions, which is made up of two nucleuses. We have the superior and the inferior one. So it's called the superior colliculus and the inferior colliculus. So the superior one is, that is where the optic nerve passes through, and it involves the movements of the eye. The inferior one is where the auditory nerve passes closer, and it involves in the regulation of auditory reflexes. Okay, so still part of the medulla, let's look at the midbrain. So the midbrain, as I said, this is where the oculomotor and the trochlear nerve originate, and it controls the movements of the eye. So the pons, this is the lowest region, and it controls the REM movement or the REM cycle, micturition, blinking, and the muscle tone. We have what we call a region called the reticular formation. This is a small region that is in between the brain stem. We have a region where all the nerves that come from the rest of the body passes through, and this is where your part of awakening is controlled. Once we activate this region, you become awake because the sensory is activating it. Like right now, you are seated, you are not asleep because this region is unactivated. Once we have the disinhibition of this region, meaning much of the impulses are not able to go into the brain, you will immediately go into sleep. So the reticular formation is involved in the functionality of arousal, or your ability to be awake. That is a function of the reticular formation. Finally, we talk about the thalamus. So the thalamus is just a region just below or above the hypothalamus. And it's a region where a lot of nerves converge into, and it's involved in the movement of all motor activity. And all the nerves passes through there except the olfactory nerve. And this has a very cool explanation. For example, in your sleep, as much as you are sleeping, but when someone bring a nice perfume or anything that is stimulatory in terms of olfaction, it's able to stimulate you even if you are asleep. And the explanation is here because the nerve that originates from the nose, called the olfactory nerve, doesn't pass through this region. And because when you are asleep, this region is deactivated, it means you are still able to smell even while on your sleep. So we are almost toward the end. Let's talk about the hypothalamus. And it controls the function that we call it a vegetative and endocrine function. You remember we talked about the anterior and the posterior pituitary gland, and you say the posterior pituitary gland hormones are secreted from the hypothalamus, and that one is an endocrine function. This vegetative function involve all these other functions, such as hunger, when you feel thirsty, when you're sweating, the desire to eat, the satiety effect. All these functions are regulated from the hypothalamus. And you don't have a clear region in the hypothalamus, that this region plays this very specific role, but we have an overlap of all those regions. So in summary, that is the nervous system. We said we have the central nervous system and the peripheral nervous system. Central is made up of the brain and the spinal cord. The peripheral is made up of the somatic nerves, which are 31 pairs, starting all the way from the cervical into the sacral. And we also have the 12 cranial nerves, which are either sensory, motor, or mixed. We also went ahead and see the cells of the nervous system. We have the neurons, and we have the other cells we call that have the supportive functions within the nervous system. Those include the astrocytes that have a function in maintaining the blood-brain barrier. We also went ahead and looked at different parts of the brain. We have the 5 regions or the 5 lobes of the brain, and each one has a very specific function they play. That is include the occipital parietal, temporal, and frontal. We look at the brainstem, it has 3 parts. We look at the pons, medulla, and the midbrain. And we said the hypothalamus is involved in controlling the vegetative functions of the brain. So that's a summary of the nervous system. I know it's a little bit, it's not so much. We have only done it at a superficial level because of the in-depth involved in it. So I'd say request that we hold maybe another session next week to talk about the special senses and muscles. And that one will end our session in physiology.